Dr. Leon McDougall, the president of the National Medical Association and a professor of family medicine at The Ohio State University. Great to see you. Thanks so much for being with us, Doctor.
Good afternoon.
Well, the letter was put together by the Black Coalition Against COVID-19, as we mentioned. Walk us through the significance of this organization and why you feel it was so important to sign this letter.
It's critical. And you spoke to earlier about the lack of trust in the Food and Drug Administration and the government process that have created the vaccine candidate. So we've come together to let the Black community know that we're a part of overseeing the data. For example, the National Medical Association established a COVID-19 task force where we have assembled experts who have been meeting with Pfizer. We have met with Moderna. We have met with AstraZeneca. So we're looking at that data also. We plan and hope to be in agreement with the Food and Drug Administration. We're a side-by-side voice that will look at that data and also share our thoughts on safety of the vaccine so there could be more confidence in it.
And Dr. Leon, let's talk about some of the things that cause that level of mistrust, or at least contributed to it, because we'd like to think that the quality of medical care that you receive in this country has nothing to do with your skin color. But studies have found, for example, that Black patients are less likely than white patients to receive treatment for pain. Black mothers are more likely to die in childbirth. Why does this happen, and how is it affecting how the pandemic is impacting Black Americans?
So now you're speaking to racism, structural racism, and its legacy and ongoing events of today. And many communities, such as mine here in Columbus, Ohio, we've declared racism as a public health crisis. So, and also there are historical events such as the Tuskegee syphilis experiment. That being said, we don't have to go back to the 1930s. We can focus right here on 2020, on how Black and brown people weren't being counted initially for this pandemic. Hard to find the information, but there is distrust, and we don't have to go back in history. We can look at 2020.
So, Doctor, this love letter to Black America, as a Black doctor, personalize this time for me, will you? What has it been like to deal with this pandemic and see so many Black moms, dads, children, family members impacted by COVID in such high numbers?
Yes. So I'm a family physician practicing on the Near East Side of Columbus, Ohio, a predominantly African-American community. And it really hurts my heart to see the effects of COVID-19 on the community. For example, one of my patients, around 35 years of age, former college athlete, actually looked like the Incredible Hulk prior to contracting COVID-19. So what happened? He was in the ICU for over a month, had to be placed on dialysis for kidney failure, and just tragic. Now, I have some good news. He was able to transition off of dialysis, but it just kind of speaks to it's not just whether you may live or you may die. No, there are chronic ailments that one can develop related to the COVID-19 infection. And then to hear about family members, grandmothers dying and that affecting the mental health of other people in the family, it's really tragic.
Well, doctor, we lift you up for what you're doing, not only as a physician, but just a human being. And we always appreciate a good love letter. Dr. Leon McDougall, thanks so much for your time today.
Oh, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.